Kiersten, a senior nursing student at Salisbury University.
I'm Adi, senior at SU School of Nursing.
I'm Christencie, I'm a sophomore at Salisbury University.
I'm Tara, I'm a senior at Salisbury University. So for our first idea, we have a discharge nurse. So the discharge process can be chaotic and time consuming for both patients and the healthcare team. For patients, it can be overwhelming and confusing receiving new information from multiple different people. They may feel rushed and leave with lots of questions unanswered. For nurses, the discharge process can be seen as just another task added to their to-do list, contributing to the rise of nurse burnout. It can take time away from other patients that need active treatment and care. Wouldn't it be nice to have someone else handle the discharge process? Well, a discharge nurse could do just that. Having a designated discharge nurse allows for more efficient and organized discharge processes without compromising the quality. The discharge nurse is able to spend quality time with the patient in a closed-loop communication setting, therefore decreasing the risk of confusion or misunderstanding, common causes for readmission after discharge. Designating this process to other nurses decreases the stress on others, therefore contributing less to burnout. The discharge process is able to be completed in a more timely yet still encompassing and comprehensive manner, maximizing its efficacy.
Our idea is unique because it tackles problems in the going discharge process, like confusion, wasted time, or nurses burnout. It targets the nurses in case management, and it delegates specified role for efficiency. This approach allows for close communication. Instead of having multiple nurses going back and forth, we feel like having one dedicated nurses that's there that's there specifically for discharge would be really helpful, because that can create more for doctor and other nurses to do other tasks. And what is the target market? Our main target market is major hospital and units starting at the emergency rooms and move its way up. We feels like major hospital will be the main priority for unsafe discharge.
So our second idea is also intended to help improve the discharge process and therefore hopefully decreasing readmission rates. During discharge, there's often a lack of communication between the nurse and the patient, leading to the patient's lack of understanding about the proper care that needs to continue to take place after discharge, such as adhering to medications, knowing how to check blood sugar levels, and knowing how to properly use medical equipment while at home. While patients should be sent home with the proper knowledge to continue to care for themselves, they often leave with more questions than they arrive with. Implementing a free app that would be set up for the patient upon discharge could help reduce this problem. The app would be personalized to the patient with their own specific login and resources available that are individualized to their particular health problem. Upon discharge, the patient would be aided in setting up the app on their phone, including inputting their primary language and the health issue at hand. AI will then pull from an approved list of videos and resources that are ready available at the touch of a button for the patient to refer to at any time during or after discharge.
This addresses problems like lack of resources, deficits in knowledge, and misunderstandings when it comes to treatment and management of care. It helps with the culmination of resources, so it will have videos, articles, pictures, and in-depth instructions, which is meant to attack all learning styles. So if one doesn't speak to one person, we can individualize the care and individualize the content they are receiving and help them understand and empower them with the tools to move forward and take care of themselves. It also vets the information in a way because professionals can see what is on the actual site, so they can curate it more so, and also if something is maybe out of date or something that they aren't particular about, they can comment on that and push the other information to them. It promotes collaboration with clients, families, staff members, and even teachers for younger clients or professionals, broadening the scope and adding education. It also eliminates the problem of paper. So as we give papers to discharge, they can get crumpled, they can get lost, they can end up everywhere but where they need to be for the client. And what this targets is, the target market for this is obviously hospitals, but more specifically it's the clients. So that could be older adults, and obviously we would touch base and help them, so we're not just sending them with hey, look at this app. There would be significant amount of care and nuance to each actual case. Non-English speakers, so they have more resources as well in a language that is preferable to them. And even someone who's just stressed out or confused at the time of discharge. We've talked about this whole time, how it's a stressful process and there's a lot on that plate. So this gives you those resources in a timely manner that you can take them and incorporate them in a way that actually works. So, that's
All right, thank you.